Hello, and welcome to CRPN Central, getting better by the day thanks to Mitch Hilby and some really good creations. Again, this is the podcast where we're bringing in some of the best minds in this industry so we can talk about our challenges, identify solutions, and get something done to make everyone's lives better. Please be sure to like, comment, and subscribe. It helps this mission a lot and show that you support CRPN and the innovation that we need in this industry. Coming onto the stage, Mitch Hilby. How you doing?
Hello. Doing great. I've got so much energy. I don't know if it was those like fire intros we've got now or all the coffee and like C4 Smart Energy, but yeah, thanks
I
for
don't know
calling
about you, Mitch.
Greatest minds too. That's amazing.
So there's another big excitement, and we won't talk about it too much because we promised we weren't, but there's something really cool going on in Sugar Land, Texas today, isn't there?
There is. I don't know how much you want to talk about it or not, but yeah, we have a congressional event that it was postponed. Unfortunately, when we were there in person, there was issues following the hurricane. Totally understandable, but we were able to pivot and have like some sort of an online presence today. So we've got that this evening. Pretty exciting.
Yes, and a big special thank you to Dr. Liliani's office in Sugar Land for the support of clinical research. We will go no further because I think that they want to control that, but expect that later. And so, Mitch, patient databases, participant databases. Oh God, another data podcast. Really? What are we talking about here? What'd you think of the podcast this time around?
So normally I always kick these off with how similar like the stances are. This one was probably the only one that I've heard where it's almost like this aspect of like paper versus e-source, right? Where we have almost differing kind of viewpoints. Not that Samir is like anti-AI, but Samir is much more, building that bespoke platform for your site, building it out himself, and then not sure the overall benefit to how AI could be implemented to help streamline that fully. Keep wanting to keep more hands on the reins, if you will. And then you have Dr. Bhosale's platform and her company with Steve Health, and it's like they jumped and landed on the boat, and that's exactly what they do. So it was kind of interesting to hear both of them, but they have like the exact same goals and the exact same mindset, just coming at it from different approaches, and that was pretty interesting as well.
That was pretty cool. So without further ado, coming onto the stage, Samir Huda, Dr. Arati, Bhosale. How are you doing today?
Good. Thanks for asking.
That's great.
Yeah, namaste everyone.
Yeah.
Nice to be here.
So before we start, would you be willing to introduce yourselves? Ladies first.
Sure. Namaste everyone. This is Dr. Arati Bhosale, and I am glad to be here. And Mitch, you covered the summary very well. I was excited. The approach itself is unique, Daniel, because, the guests don't know about each other's, interviews, how they went. And then you get to see the comparison when the whole episode comes out. And yeah, I mean, it was great. And I always love listening to other people's perspectives. And so, yeah, it was awesome.
Yeah. Samir, would you be willing to introduce yourself?
Yes, of course. Hello, everyone. My name is Samir Huda. I am the Business Development Manager here at Prolado Clinical Research Center. We are a 5-year-old site that's mainly starting in nephrology and rheumatology, but we're expanding to different indications of all different types. Something that's different about us is that we have our own in-house database that we've created. So that's kind of where this whole podcast, my experience from this whole podcast started. Excited to talk about all these different points today, and hopefully we can get some really great discussion out of this.
Yeah. So Artie, I knew you originally through an interview you did with Brad Hightower, if I remember correctly, long time ago in a galaxy far away, and we've become friends ever since. And Samir, I just met you in Houston, and oh my gosh, what Prolado is doing for their community is amazing. I mean, the growth that you have done, especially under your command, for what you're doing in technology, is just phenomenal. It's a true inspiration for all of the sites in the industry. So I'm really thankful that both of you took the time to come talk about participant databases and databases in general and how we can work on them in the industry. And the cool thing is, Samir being at the community level and Artie being at a company level, you both have, as Mitch said, different perspectives, but similar objectives based off of what we're doing. So
Yeah.
I had a chance to listen to this podcast in particular a few times, and I wondered if, as you had a chance to listen to it from your different perspectives, how you viewed and saw the perspective of the other person.
I mean,
Go ahead, Artie.
I definitely think that, AI has a big impact on various different things. And I think that, Steve and all these other companies that are using AI for, narrowing down patients, it definitely has a value. And I definitely think it's going to change the industry. All I was saying is that for our site specifically, we aren't using it as a recruitment tool just yet because it just isn't at that level. We don't have API access. We aren't able to go through entire EMRs. We don't have multi-site level agreements where we can, scrape millions of patients or anything like that yet. So it's a work in progress. But I do definitely think that as technology grows, as it expands, as AI gets into its next wave of evolution, I definitely do think that it will help because like humans aren't capable of understanding like 80 different 80 different protocols with hundreds of different inclusion criteria, right? It just doesn't make sense.
Right.
So I do think that eventually, as studies get more complicated, as there's more like inclusion criteria, as there's more categorization criteria, like the error population, I feel like technology is the only thing that you can really target, like rely on to be able to process through all that data. I just don't feel that our site is at that level yet. I believe that the tool that we made for like the chatbots, they were helpful to a certain extent. But if you have recruiters who are there full time, they eventually know the studies better than the agents.
The
Right?
chatbots.
It might have a use case if you're doing a mass enrollment study for like the flu or something, and you're trying to like have an online pre-screener or whatever like that. But for rare studies, it just doesn't work for our site. But I do want to clarify, I do definitely think that AI and all these different technology tools will have a big impact, and I'm not against it. I'm the last person who would be against it.
You're not anti-AI.
Oh, no,
I
sir.
Yes.
didn't present it that way.
All I'm saying is that for our site, it's not the best fit just yet.
Not there yet.
Eventually it will.
But you are implementing like some of those smaller like AI features, and I know that's
and
actually
we're working with different vendors too now to like add different like features like the ability to scrape because they already have these agreements with like Epic and all these different companies to actually like be able to go in versus if it's a recruiter going through and calling, like, yeah, it does help. But it doesn't make as big of a difference as if you had company level access, if that makes sense, which I feel like is one of the reasons why Steve is able to, go through and like analyze so many different patients is because they don't analyze it from like a recruiter perspective. They analyze it more like and do like on a business to business agreement, from what I understand at least.
Yeah.
So that's an interesting segue. So Artie, I guess that brings open a two-prong question is for anyone who doesn't, could you explain Steve real quick and then tell us about your impressions of the interviews?
Yeah, sure. And so Sieve is a tech platform. So it's more like an ERP, but our focus is on patient enrollments. So I mean, usually we are boxed into that patient recruitment category, but that's not what it is. That's our baseline, right? Identifying patients and all of that. Our main focus is on reducing administrative burden by leveraging AI. That's the baseline of it. Now, yes, we started with identification of patients, but patient enrollment goes way beyond that, and the goal is to amplify human potential. That's the whole goal of SEEF, and that's what we do by leveraging AI and bringing it to join forces with the human forces and just amplify and streamline the whole operations and all of it with regards to patient enrollments. And it can be customized as you need, it can be scaled as you need. Solutions up until now have been like, yes, I mean, integration into the EMR databases and all of that, but technology evolves every day, every minute. And so Sieve is evolving with it, and we have introduced so many new features so that it caters not only to bigger hospitals. That was the case when we rolled out our platform, but now we work with multiple groups across the industry, including independent single owner sites to site organizations to CROs to sponsors, everything. And that's the beauty of technology. It can be as small or as big as you need it. And so my impression of the episode itself, it was really cool. I mean, I did notice a lot of comparable points, even though they are coming from different perspectives, because the end goal is the same, right? And so my impression in a summary was that industry agrees that data and tech can be leveraged to optimize workflows. No, there are no double kind of minds. I mean, we as human beings are in an era where tech and data are here to stay. That's it. That we all know that. We all use it in everyday life. It just we faced our industry faces, the clinical research industry faces challenges when it comes to tech adoption or leveraging data, is because the solutions are fragmented, and it leads to frustration. And so the five main approaches, which I noticed there are comparisons between what Samir mentioned and what I was getting to, is um, the five different ways you can enable data leverage and improve tech adoption is interoperability, data quality, data structure, and it should be built on user needs. And data and tech are here to stay, so don't shy away from it. Have out of the box thinking and just embrace it. Figure out different ways of leveraging it.
Yeah, absolutely. So the other thing I came up with the beginning of this month, I saw something come out from Epic, and it talks about like APIs, similar use to like MyCharts, where essentially everyone at Epic, they improve their interoperability to be able to allow those patients to send their health data anywhere. And there's this initiative, TEFCA, it's the Trusted Exchange Framework and Common Agreement. It's initiated by the US government to kind of standardize that framework for health information exchange. So there's a lot that people can look into regarding that. But I did want to bring up a comment real quick as well, because Kelvin asks, are you adding RAG and fine-tuning solutions? And I knew what you were talking about, fortunately, retrieval augmented generation. Of course you would know this. Kelvin knows everything, but retrieval augmented generation and fine-tuning, I guess to summarize it in my really, really rudimentary way, is the retrieval augmented generation aspect is more so entering like a query to kind of pre-pull this information. So if you have a patient database, for example, and you're looking for a specific, therapeutic area, maybe you can query to try to find and scale this list. And then fine-tuning is that aspect of pre-training your language learning models, like your AI tools, to be a little bit more specific with what you're looking for.
I learned something new today. Wow. So any comments from the guest?
So for the chatbots that we had, we essentially how we used AI, or we tried to use AI at first. We're still like building it and seeing other ways to potentially use it. But originally what happened is that we would load it up with blinded protocols and basically create our own instruction set, which kind of goes into the fine-tuning solution. We didn't have any way of on the user side adjusting like various features like on a scale or anything like that, but we did train the model based on various protocols and those sorts of things. And the overall way that you would interact with the system was through a chatbot, and it was hosted on our ERP. So we just had like a web portal inside of our ERP that would lead to a chat GPT based agent, and then on top of that it would just have like various documents and other instructions. It wasn't like its own like
Right.
LLM or anything like that.
Right.
So what do you think, Artie?
Yeah, I mean, and that's a great question. And so, yes, like I said, technology is evolving every day, every minute. And so, yes, we use this approach in ours too. Our platform uses that. And because that's what machine learning is about, right? Like you have to fine tune all of that. and it's a funnel effect. That's how a human brain works, that's how a machine brain is going to be trained and work as well. And so it has to mimic the same procedures so that we can achieve the desirable results we would through human efforts. The goal is to mimic them properly so that the results are predictable for the purpose, because they are done. The industry has done an amazing job of streamlining the workflows itself, so we don't need to reinvent the wheel. All we
Yeah.
have to do is teach those machines to mimic those thought processes, those workflows, and how to augment that functionality, right? So yeah, I mean, it's
Yeah.
up to you how you want to leverage. And so that's why I'm saying, like, yes, it can be daunting when it comes to all these acronyms, and because it changes every day, adds every day. But yes, I mean, there is no reason to shy away from it, uh, as long as we keep our end goal in mind, that we want to have a proactive data leverage and, tech
That
adoption.
was
It's here to stay, so we just have to figure out a way to use it.
yeah, that was one of the strongest points you guys aligned with, and you said it in a little bit different ways. But Artie, you use the term garbage in, garbage out. We talked, I think, on the podcast last week, Fox, with that same kind of concept.
I think it's the feasibility one. Yeah.
I think multiples. We always talk about
Yeah.
the garbage in, garbage out aspect, because it essentially, the point that you're getting at is it's not necessarily the tools that you have that are the problem, or the tech isn't necessarily the problem if you don't utilize them to their extent and you're not working with them. And I think, Samir, you kind of hinted at that in a way as well with, some of those tools and like the chatbots that you were building. And it's like, well, not everybody's utilizing them, right? So they might be more functional if they were better utilized, or people were like more trained on how to use some of these tools. But it's a lot to kind of adopt those new processes. And with Artie, you were talking and workflows.
That's kind of why I'm saying it's easier to have it on a company-to-company level, because you don't need everyone to be trained. You just need to give them a list of these are pre-qualified candidates that qualify for X, Y, and Z study. Just call it simple.
Yep.
Makes
Exactly.
sense.
Exactly. Well, I like that your lazy mindset.
Yes,
I like
exactly.
that. It's your greatest strength and your greatest weakness, right? Because you
Yes,
want to develop things that make your life better.
Mm-hmm. The less I have to do, the better.
Yeah. And I
the one
second you, Samir. I was smiling when I had heard you say that, because I'm the same way. That's how C was developed. I mean, that's how any innovation is developed.
Mm-hmm. You see a problem
you
and you
have a
create a
drive to
solution
be
for it.
better.
Mhm.
So one thing you both hit just the nail on the head on, I could have sworn you talked to each other before we had the interview, was you both agreed that there is no standard to structure data.
Mm-mm.
And do you remember that? Do you remember you saying, it's kind of all over the place. There's no real standard on how we can organize these data for databases, which may be a result of we have the best tools ever, but nobody's using them all the same way. And it went back to Artie. You said something that really resonated with me. You said that the use of databases and technology can prevent like emergencies, right? And
Yes.
I wondered if we could combine those two together. One is the creation of some form of a data organization standard for databases, plus how that does actually help to avoid emergencies.
Right. So yeah, I mean, I truly do believe that, because I would like to bring up what you had said during the episode as well about data, right? Like, we are drowning in data but starving for information. So that's where the data structure or harmonization comes into play, because it's such fragmented, systems or databases, and everybody has developed them over years for their own purposes in different ways. The challenge, because for technology, like when you're teaching or learning, imagine like a small kid trying to learn, like English could be an universal language, right? But what happens when a kid is growing up in different cultures? Imagine different kids, different languages, they are growing up with it because they are in those environments. But when they come on a global level, English helps them connect at a, and so that's where we are right now. The data structure, everything, because of those local needs and everything, these were fragmented. We have to figure out a common language, and that's the task right now. That's where we are right now, to map that, to find the similarities, like this in this translates to this in this database, right? Like that's where we have to figure out the translation of those different data structures, where the harmonization can come in, and then have a different, and going forward, of course, we can change it, because what has been built and done, we don't want to waste it. We don't also, we have to figure out a ways of matching and mapping, but also we can change as we go forward on agreeing upon a certain set of rules. That's where that common language analogy is, and then we agree upon that, we build the data in that structure so that it's easier in the future going forward. Plus data quality comes into picture, and then all of this eventually would lead to a proactive approach, right? Because traditionally our industry is reactive to everything. There is a problem and everything, and then we run after, like, how are we supposed to do this, all of that. But the biggest value that data brings in collaboration with technology is the insights and the proactive nature of, that's what leads to the proactive insights, right? Like if you understand what's coming in front of, or what's the scope of it, what are you looking at, you can have a better approach of taking it on, addressing it, and a better structure. And so that's what I mean when I mean proactive, I mean feasibility, trial designs, everything. Like if you have a prior understanding or a better understanding of what this all means, the scope of it, where are we trying to go, and then identify those gaps and address those gaps on that path. Otherwise, you're going in blindly right now.
Mhm.
And then you are kind of, um, adjusting your journey or your approach accordingly, because you know an end goal is there, but what you don't know, you're building the path as you go. Why not have a path designed before? So yeah.
Yeah,
Makes you
there's a couple
wonder. Yeah, go ahead, Mitch.
there's a couple barriers and challenges that I think we've faced as an industry that, you know, they're self-inflicted wounds. Um, but I would like to hear your guys' opinions and thoughts on it as well. So there's a couple of the points that I want to make is that regarding what you're talking about, Artie, is one, when it comes to like the feasibilities and the processes in these tech that we're building and mapping patient databases and things like that, all of it is very proprietary, and everyone who's building a platform, like that is their baby. They're going to protect it, and they don't want to share the secret sauce with everyone. So in this realm of, we have to communicate and work together to be on the same page, yet at the same time everyone wants to hold on to their own secrets to make sure that they are unique and that they have something to offer that's different from everyone else. I feel like that's been a big issue as well, is that transparency.
Good
Yeah,
old
I mean,
proprietary, right?
Yeah.
but what I would like to point out is, I mean, I understand that fear. I know where it comes from. I would do the same. But what we need to understand is the difference between, where is that hesitation coming from? Like
Mhm.
proprietary and all of that. Yes, what we are trying to protect, we are all trying to follow HIPAA regulations, right? And we are trying to protect the PHI, right? What I'm talking about of mapping and developing a common language and structure is it doesn't involve PHI. It's the backbone of it. It's the structure of the database itself, right?
It's
And the
like a
different
SOP on
database.
how to design a database, right? Almost.
Exactly. Right. And so different databases have different structures, and what we need to work in collaboration is mapping what the different databases, like for example, if somebody is capturing uh, diversity data, like race, gender, ethnicity, and everything, I mean, there are some that are common. Yes, you can tag it, almost tag the same way, but in different databases, certain variables, even if they are same, they are tagged a bit differently. And so that's the mapping I'm talking about, that for those two databases to be talking to each other, and that's what is needed. That interoperability is needed for us to go forward, and for
Yeah.
that, the harmonization and the mapping needs to happen. and it doesn't have to involve PHI. So we need to address that fear by pointing out that those differences, nobody is seen for PHI. We all understand, we all as an industry understand that and follow that. Nobody is wanting to. Yes, I mean, I can see where that fear comes from, but then we also need to agree upon the rules and play accordingly.
Yeah, I mean, so back in April, we worked with or at least talked with Beck Health about something similar to that. And I know Beck Health is probably like a direct competitor of yours. But essentially worked, and we're talking about like the granularity of the data that you're able to source from, systems like Epic, and, making sure that we're not putting in those barriers, and we're actually bridging all that stuff. So if a patient reports their own race and their own ethnicity, and they report that they're Lebanese, so we get that on the back end, right? We're not like pre-scaling that anywhere else. So we want to make sure that A says to B exactly the same thing that it's coming from A is essentially what I'm getting from you. And I couldn't
Yes.
agree more. Yeah.
Yeah, and I mean, yeah, I mean, I know, like, I'm glad that that's what you're saying. And for me, I don't look at competitors as competition. For me, it's being peers. We are all trying to solve a problem, and I love to join forces rather than, being a competitive. Like, that serves no good to anybody. We are in this industry with a common goal, and we all need to focus on that. And there are different ways of solving. I mean, if there were no competitors or whatever, like, there wouldn't be multiple banks or multiple grocery stores. I mean, there are customer needs. Everybody needs different things, and it's okay. And so that's what I'm talking about. Thanks for summarizing. Like, yes, like the
I'm
matching of.
so glad you said that, Artie, because this is a really weird industry where everyone thinks that they can own the industry. And it's like, this is an ecosystem. We use the term ecosystem on a previous podcast, but the point is that's kind of how it's supposed to work. And Samir, I want to get your follow-up on that, but real quick, for anyone watching this later, go to the LinkedIn post for this and look at all of the comments Kelvin is posting. These are amazing. He's got examples of studies. He's got PDFs. I want to come here. He said, yes, there are a lot of closed systems that should not be. Yes, Kelvin. He's also bringing, 2027, we got some new regulations coming in. If you're not interoperable, you better watch your Medicare, Medicaid. So there you go. We're going to start to squeeze the coin purses, the money part of it. If you're not interoperable, you're not going to do Medicare, Medicaid. That's going to be a huge push.
That'll definitely
But
help.
unfortunately, it doesn't apply to commercial.
Right.
So, they're going to do what they can, but where Medicare, Medicaid goes, everyone else will follow because they're going to have to start working with that. Samir, I wanted to follow up with you on what Artie was saying from a site's perspective, talking about harmonization. What are the challenges of you as a site to try to get a harmonized database system together for all of the different systems that are being thrown at you right now?
Where do I begin? There's so many different like places and vendors of information that, like, I'm surprised our coordinators are able to go through all of it. And there needs to be some sort of change where like they have like one system that can interact, or either one system that can interact with all of them, or each system has the ability to interact with each other's, and there's like API calls or something, because it's getting to a point where it's pretty crazy. You have different payment method vendors, you have different EDCs, you have like everywhere you look, there's like one new sponsor that's creating like their own platform, and it doesn't actually like create any tangible benefit. The benefit of having like all these different vendors like using the same tags and language and programming is that whenever you do queries, you can actually like get insights and actionable data. Because, for example, if I want to do a query on an EMR for Berger's disease, for example, right? Some people only tag it as IgAN, and some people don't use ICD-10 code. Some people only use it certain ways. Some people write it down and fax it, and that's not readable. So I definitely think that the industry would benefit and could get some like increased efficiency from being able to like utilize AI to kind of take in all these medical records and process it so that we have a digital record of, why this patient came in. These are the various things associated, so that you can actually like in 10, 20 years, you can actively see maybe even have better trends and understandings of if this patient came in and got COVID on this day, and then within X amount of time they received a vaccine, then in 30 years they had an increased chance of this. It's really important to start collecting information, and in your mind have this SOP that whatever you're doing, it needs to kind of you need to create your roots really strong, right? You need to make sure that the data you're collecting, it's all on the same code, so that whenever you search it through one platform and another platform, they show up the same, and all these different things. If you don't start now, by the time you're in the future, by the time you've built your data set, you're going to realize that it's not really that beneficial. It's not that valuable, because you can't do anything other than count the number of patients that you've seen, right? So it's important to kind of have that in your mind, that I want to collect this information because eventually I need to do this. So that means that the tagging needs to be well thought out. It needs to be the same across everywhere. Various little things like that. It seems small, but you let that fester for 20 years over thousands of different companies, and you see the problems that the industry is having now. So I think that conversations like this are really, they help push us in the right direction.
Well, on an international scale too, I mean, there's different things outside of ICD-10. So I know across the globe there are initiatives, volunteer initiatives from different agencies that are putting together those language mapping models. So it's they're picking up on those keywords, like you said. So if you type in some indication or some variation of an indication, it'll populate and show you what that ICD-10 code is, and you can map back and forth. But yeah, I mean, it's everybody using the DIA eTMF model, right? We have one standard eTMF model. That's how it's structured. That's where all the stuff goes. And no one usually has an issue with it until someone starts to try to reinvent the wheel, and then everybody's like, what are you doing? None of this makes sense. Just do what everyone else is doing.
And sometimes it's okay to reinvent the wheel because it's better, but you can't keep doing it every other day. There needs to I don't know, but it really has gotten out of hand, and I feel like a lot of people agree with that.
Yeah.
Mm-hmm. And I love the thought that you just said of almost like a technology foresight, where you're thinking, okay, we don't need this yet, but we might need it later. Or we see some, for example, some guidance or some regulations coming down the line where we need to be very proactive about the adoption of technology. Do you think that in some ways that just grab it all while we can and don't collect precise information that we need to make decisions, do you think that exacerbates the problem where just everyone is trying to collect everything?
I mean, if it's all being collected with the same principle and thinking, then you should still be able to query through it. It's not a person that's looking through it, it's technology. And I feel like if you give technology information, it's able to make more informed decisions. I don't feel like it necessarily has negative consequences. It might, create slowdowns for recruiters and coordinators who are entering this information. But at the same time, if you're designing it well, or if you're creating rules that automatically fill other boxes and various things, it doesn't add too much extra steps. At least that's what we found from our database. Yeah.
Yeah, I mean, we had the conversations about that with feasibility, but to your answer, if duplicated entry can just be auto-populated in things, then it's not a big deal. But when you have sites with 50 pages of feasibility that, you really only need 9 of them to make a decision about the trial, then it tends to overload the duplicated effort.
Yeah. I mean, there's definitely, as far as workflows and processes go, a lot of that could be streamlined, because especially in feasibilities, you have so many standardized questions where if you have, say your house on a platform and it's yep, we've got a -20 and -70, blah, blah, blah. This is how many centrifuges we have, and you kind of keep that up to date, then everyone has those answers. Those answers are already done, and then you really need to get in and answer a handful of questions that are maybe specific to those trials. But I mean, Samir, you had a great point too. It's, asking, like, feasibility is asking like tons of questions, but they're not detailed, or at least the information you have isn't detailed enough to even be able to answer those too adequately. So most of the time, our feasibilities are like a best guess. We think we should be able to enroll this many patients, but we really have no idea. And feasibility is a whole other world of issues, because a lot of times the feasibility, the sponsor doesn't even have the protocol finalized. So you can't even answer those questions the best, because they don't even know exactly what those needs are of the study yet. So you're really just ballparking it. Like, we've got X number of total patients with this indication. We can maybe get a percentage of that, but then you get that inclusion exclusion criteria and you're like, nope, we can get you 2, so whole separate.
And again,
Just make a random number generator, and then you problem solved.
Right.
So I was thinking a lot still about Artie's comment about how very well thought out, structured, and planned quality by design databases, data collection, things like that could prevent like a catastrophe or an emergency. And I wonder if we were to get this performed properly upstream, get everything in place, do all of that, like, how many protocol amendments do you think could be prevented in the industry?
Yes.
Or things that are causing delays in the trial as a result of going off of misinformation from the databases? Do you think that's happening right now?
I don't think that's happening right now yet to the scale which it could. I mean, to bring in real value. The reason being the data quality again, right? I mean, the data quality is not there yet. And just even the fragmentation, the interoperability needs to be improved for us to reap or kind of get that benefit of proactive use of data, to have those insights and everything. They have to be reliable, right? And so that's where the data quality comes into picture. Is like you have to make not just informed decisions, but also there's a risk associated with it, right? Like, what we are trying to avoid is, the goal is to avoid these emergency situations to begin with, we have to leverage data to kind of identify all different possibilities, the probabilities of it, and all of that, right? But how would you do that with confidence when there is data quality? That level of data, that level of detail is there, and that it's repeatable, that it's reliable, and structured in a way. And so, yes, you can do a lot of things with proactive approach. You can avoid all the emergency situations, because the feasibility itself, it's one of my pet peeves, because we are just doing the bare minimum basic right now. Like, so much can be done by leveraging data and technology to improve the feasibility itself to begin with, and the design of the trials, and do it right from the start, right, instead of later on with the banded approaches. That's what we do. And so technology is not a magic wand. It cannot come and fix something for you that isn't just possible. Like, that's not how it works, right?
Yeah.
I mean, so
Yeah.
we have to.
ICH, Fox.
Quality by design. There's your tattoo, Mitch. You got to get it, man.
Every episode.
So, Samir, and what do you think, Samir? I mean, if we had a structured, universal standard for data collection and databases, do you see any kind of a streamline or prevention of problem further downstream when it comes to protocols or anything like that?
I feel like if we have like a unanimous language for these data sets, and if we have access to these EMRs, sponsors would technically be able to find an infinite amount of patients, right? Because they infinitely scroll through all these different hospitals and basically flag them, say that you potentially qualify for XYZ. Talk to your doctor about it. It might be of interest. right? But that doesn't happen without actually like, having a system where you're able to do these large macro analysis on, which areas that you need to target, which hospitals have the certain like patient populations that you're looking for. Um, I feel like there's a lot of like hidden benefits through having like a standardization, because it allows the sponsors, the sites, and the providers of the patients to kind of be on the same page, because right now everyone's speaking a different language, right?
Yeah.
So I definitely think that it's necessary, and I do feel like it'll eventually happen. As Kelvin was talking about, it's only possible through regulations and decentralization. So the regulation that he mentioned earlier, I'm hoping that it will have an impact. I get that it's not like direct impact, but the trickle down effect will hopefully make it so that sponsors, vendors, all these different companies will figure out and maybe like come up with a white paper to kind of say that this is what this needs to be tagged on. These are all the codes that we're using. This is the right way to do X, Y, Z, and then from that, hopefully, we'll be able to come out with some more softwares and technologies and solutions that will allow us to interact with the patient population a lot easier.
Yeah, I mean,
Yeah.
I think from a larger scale, I've had that similar concept, and it might be a little bit off of what you're talking about, but as far as like reaching out to patients, right? It's essentially like tokenizing everything, so you don't necessarily have their personal information, but if you can input this information, run your study through, your EMRs, and then it just kind of flags that to the patients. But I think it's important to always remember, because we're talking about patient databases specifically as well, they own their health data. Like we all own individual health data. So then there's those other aspects of, essentially a patient I would have to pre-consent to allowing myself to receive notifications about, potential clinical trials if I'm with like my chart through Epic or something, to be able to get flagged those notifications. But I think that's going to be like an important takeaway in all this. Like as we talk about data and transparency and communication and standardization, it's okay. Well, at the end of the day, we don't have a right, essentially to any of the data unless the patient wants to give it to us.
I'm so glad you said that, Mitch. That was one of the last points I wanted to do. So if you're watching this on YouTube right now and you're a patient and you're like, what the heck? They're talking about these patient databases. What are they doing with my data? They're making money off of me, all of this stuff. So yes, that is a really true point. So there are people out here right now, companies trying to create little data wallets where you control your data. You release that data to certain trials, to feasibilities, things like that. Here's the kicker. Every time you walk into your doctor's office right now, you go to the chart and you fill out the paperwork and in there, by standard, it says that you give that clinic or doctor's office permission to put your information in a database for research and education purposes. By being in that EMR, unless you take the steps to not be part of it, you have opted in to research potential. With that said, and with the patients and participants in mind, Arti, Samir, when it comes to patient data, what are your protections that you do at your organization to help to protect that data? Because I know that you both do some very, very strong things.
Sure. So, I mean, patient information, protection of that is and should be baseline of the industry itself. Like, whenever we are developing all these new solutions, whatever the solution might be, the previous ones or the ones that are upcoming in future, doesn't matter. That data has to be protected. Data is gold, and patient data, I mean, yeah, just because we are developing solutions doesn't mean, like we all are patients. We have to protect, don't misuse it and all of that. The way we do it, it's layered under 4 to 5 layers of security. It has no public access, nothing of that. And plus, we have different level. There are different ways of how you structure your solution itself, how you build it, and that's why that protection of patient data has to be in mind right from the design phase of a solution, right? And so the way it has to be designed, who's going to have access to it, and it has to be a controlled access, only when needed, for what purpose, and it has to be like everywhere, every step, developing SOPs or developing rules and regulation, this has to be in the contracts, this has to be up in the discussions, in everything that is involved. This has to be considered and discussed, and there has to be transparency around it. It cannot be hidden. Like, okay, whatever you want to do with the data, you think, like, get the right permissions. That's the approach it should be. And then, okay, if you have the permissions, then you can try to explain, have open discussions, transparency. Believe me, these are human beings, right? Try to address that level. Don't be just like, you don't understand what value technology can bring, and this and that, and it's your loss. No, everybody's hesitancy is coming from a certain experiences or point of views, or something that they are trying to protect, and in their own shoes they are right. So you have to have open discussions and transparency around this, and figure out a way together, right? And in collaboration. And so that's what we do. Definitely, I mean, that's what we, even if it takes longer, that's a robust approach. It takes longer to maybe roll out the solution, or to have the contracts in place, or all of that, but all of this is hashed out, you know um, when it comes to it, and we designed our solution to begin with from the, and any upcoming feature follows the same instructions. So yeah.
What about you, Samir?
Kind of to mimic that, we have different layers of security with federated access. There's no one who has access who shouldn't have access. Whenever they log in, they have the multi-factors and all that. All the data that we have access to is data that was given to us that patients have consented to, and whenever patients come in for visits, their information gets put into our database for future studies. Things like that. Whenever we have our coordinators or recruiters dealing with these patient referral sources, they each have like their own referral source, so that they understand that platform the best, so that they understand, like, these are the things that I need to do for this platform, or this clinic, or this doctor, or whatever. So that kind of allows them to understand the niche differences between the different sources. So various things, but at the heart of it, patient data is their data. So it's really, really important that you respect that. So I definitely agree with what you said. And hopefully eventually, like, we'll be able to come out with like a standard policy, or a documentation that all clinics will use to kind of like respectfully allow patients to participate in research if they want to. But it really just starts from discussions such as this. So glad we're doing
Right.
this.
Right. And to add, I would like to bring up Kevin's couple of comments here, like even the latest one, that invest in solution architects. That's an amazing one, right? And there was a previous comment, but yeah, solution architect. I mean, that's what we did. We
Yeah.
have multiple very amazing solution architects, which kind of designed the solution itself that way to begin with. And this is where you also, and that has to be paired with user requirements and matching, because this is all in the background, like all the design and everything that happens in background, but how it's going to serve the users that are going to use it, like that, it shouldn't also be blocking the data, right? It cannot be buried so deep that it doesn't serve the purpose. But that access is then having that understanding of user needs, who needs to see what data for what purpose, having that understanding, and then implementing that in the solution design itself. And that's where the solution architects come into play. And that it has to be, you have to put in more efforts up front to build a solution that's robust. Don't rush into it.
Yeah, investing in
And
solution architects is exactly like that point that Samir made to, wrapping up his interview portion. When, Fox was asking, like, what are you looking for? Like, what kind of qualities are you looking for in an individual to implement these systems, and, to kind of take over those tasks and those roles even at a site level. And that aligns perfectly with what you were targeting, Samir, as well.
And I know, and Artie, I know you've been through this, but trying to vet your solution into some of the larger organizations, hospitals, structures, clinics, things like that, you have to go through penetration tests. You have to show validity. You have to do all of this. You have a whole SOP on that. You have to go through IT vetting committees who approve your technology just to be part of their organization. So the one thing that I really wanted to just highlight for any of the patients or participants who are watching this right now is there's a lot of scrutiny. We're talking about throwing data and databases all over here, but in the background, there's a lot of safety and security around your patient data. And so, you can trust your doctor with that data. It's not like it's just thrown around without any kind of safeties or securities in place. I
Yeah.
wanted to highlight that because we make the assumption like we're in the industry and we know all of these things and we know what's in the background, but there's a lot that goes into it. Artie, Samir, have you both experienced that when you try to work with other organizations?
Yeah, definitely. I mean, there is just so much that you need to go through to prove that your solution is because and I'm glad. You know what? I'm not frustrated by that because I have been on the other side of that table. And I'm glad that, providers protect patient patient information and safety with that much vigor, right? And that much passion, and it shouldn't be shut down. It shouldn't be like, oh, you guys are being too difficult and this and that. No, it is coming from a certain perspective. Understand that perspective and then figure out a way to address it, right? And because it's coming from a certain point, and yes, those layers or hoops that you have to jump through, they can be maybe modified or minimized a little bit, but still some the essential ones that are there, they need to be in place, and the solution has to be designed to kind of address it accordingly. And what I would say is, yeah, I mean, this burden shouldn't be put on patients. Patients trust their data with the providers, and then if the providers are protecting it, the solution providers or vendors should respect that and work collaboratively with those healthcare providers, because the end goal is the same. We are all here for the patients. That's it. That's the baseline of it. Just always remember that.
Yeah. Yeah. That's
How
a
about you, Samir?
really great point. Yeah. Take it, Samir.
I'm sorry?
Go ahead. What about you? As far as your experience working with other organizations, the scrutiny of accessing data, getting medical records from a site.
It varies a lot from organization to organization, and some are a little bit more forgiving than others. It takes an arm and a leg to basically get a single piece of information from them. So it really depends. All these different companies have their own policies, SOPs on how to do this, and they all have different priorities on customer data. It's just important that the companies that you work for and the companies that you have, that you're putting the patient first and you're valuing their information and you're treating their information with respect, because it varies a lot. But all you can control is your company and your actions. So if you do that, you'll be fine, hopefully.
Yeah, I mean, they're kind of totally different perspectives, because I mean, I'd imagine, Samir, the majority of your interactions with like other organizations is like med record requests, essentially.
Mm-hmm.
So those, you shouldn't have a whole lot of hangups, but I do know that sometimes those are incredibly frustrating and time consuming to chase down, even though you've
I mean, and it's over something small like a birthday being missing or whatever, and the patient's the one who's like, so I understand where it's coming from. It's just that it varies so much from person to person. It's just the only thing you can ever control is yourself, right? So
absolutely, I love that. That's beautiful. But you guys both have a really great point there, with almost like, I can almost see like the respect and the appreciation that both of you have in that, because you value that these providers and these practices have such good, practices in place to ensure that their their patients are safe and that their data is safe. So there is that pushback. Like if everything was just doors open, sure, here you go, we'll send you whatever you want. That would probably be a concern, but
Yeah,
it's almost
definitely.
nice to get that pushback. Like you want to have to fight a little bit just so you
Yeah.
know things okay.
So I'll tell you what, we're coming up on the top of the hour, and let's wrap this up a little bit differently. This is a technology database podcast. So as we wrap up, would you be willing to share with the audience? I mean, this technology, we're always progressing. What are you hoping for, working on, trying to do better in this industry on a technology level that you're willing to share with the audience? How are you doing it right now? Like, what are you working on? What are you excited about?
Right now, we're trying to go more on the business end of things rather than on the patients. So in terms of like dealing with feasibility and dealing with demographic statistics and various other things, we're hoping to create LLMs and various tools and softwares to kind of streamline that a little bit. It's just me working on this, so it takes a little bit of time, and it's not a team of developers. So I try my best, but we're just creating tools here and there that optimizes people's workflows. So we've been seeing the need for an improvement in the finance and budgeting side of things in terms of like the speed. So that's what I'm working on right now. It's based on an Excel and some Python, but very simple.
I agree completely. Finance is still a wild west. I don't see solutions on an industry level coming anytime soon. What about you, Artie?
Yeah, same here. I mean, our focus has been and it continues, and it always will be building features based on user needs and feedback. That's why we constantly take user feedback, because that's the requirement of the solution itself. And then we are collaborating with multiple different groups to do our part with regards to data harmonization, improving data quality, and the interoperability. Like, our platform is interconnected with multiple other platforms. And so, because the end goal, again, all of this comes back to that same thing: user needs. We want to cater to our users, and that's what that applies to the entire industry too. No matter which solution or which vendor you are, keep that as your foundation, and then it will be fine, because that's what the industry needs. So
Yeah. And then tech wise, I guess as far as tools go, we're working on building DiversiBuddy that everybody may love and know by now. He's been in lots of different forms. He's been a DJ. There's a Taylor Swift version of DiversiBuddy floating around. He does all kinds of stuff. But we're working on making DiversiBuddy a functional chatbot to interact with clients and everyone across the board and all that we do.
So, needless to say, I'll wrap this up in just a minute. But importantly, I don't think patient databases are going away anytime soon. In fact, they're only going to be much more important to this industry as we continue to grow technology. We've got to figure out a way to standardize this, to make them usable in a streamlined fashion so we can get patients on trials, recruit them, track them, and even look at trends even later on. So this is very important, and I really appreciate both Artie and Samir coming on to talk about this. Any last words before we wrap it up?
Just always work on creating like a strong root, and you'll be fine, because I feel like a lot of the things that you develop and a lot of things that you do that create an impact on whatever industry you're in, it all comes from like the very beginning, right? As long as you have the true intention of using patient information for patient health and improvement, then you'll be fine. As long as you treat it with respect, integrity, and care, like you will be okay, because you're not misusing their data, you're not doing anything bad with it, right? So that's about it. Yeah, invest in these types of solutions, because eventually they will help you increase your efficiency, and our business is like an example of that.
Mm-hmm. Artie?
yeah, I mean, I would just repeat what I said before is data and technology are here to stay. Like you said, Daniel, patient databases are not going anywhere. So let's not shy away from them. Let's actually figure out a way of using them optimally, but together. That's
Mhm.
all.
Perfect. Mitch?
Yeah. And then I'd say, and I just want to encourage everyone to take a look. If you're interested in this topic and you're passionate about it, or even just happen to work in the industry, all of this matters to you, and it should be important. So take a look at some of those things like TEFCA, TEFCA. Hop in the comments section on LinkedIn. Look at like all these little links that Kelvin's been providing. There's phenomenal references and great articles to read that might help shed some more light on the topics and give you a little bit more information so you come better armed to this topic.
All right, perfect. Well, we're going to go ahead and wrap it up. This is Dr. Fox, CRPN Central. Thank you to our guests. Thank you, Mitch, for coming. If you're in Sugarland tonight, please give Hadi Dinawi some support as we go to talk to the congressman. And we'll see you guys next time. Bye, everyone.
See ya.
Hi, thank you so much.